tuned in tonight to our Living in Grace talk show. I'm very honored you're taking the time now. You got time, real quickly, to contact some of your family and friends. Tell them they want to tune in tonight because we have a very important program. And we'll be talking about the possibility of the vaccine regarding the coronavirus. Tonight, I have a very special guest with us, Dr. Willie R. Ross, Dr. Will Ross. He is an Associate Dean for Diversity at Washington University School of Medicine and Professor of Medicine in the Division of Neurology. As a public health and healthcare policy expert, he has worked nationally and globally on systems integrations and construction of conceptual framework to reduce healthcare disparities. He is a charter and founding member of the St. Louis Regional Health Commission, which has been instrumental in leveraging millions of dollars annually to St. Louis to maintain an integrated network of safety net primary care clinics and public health services. Let's welcome tonight Dr. Will Ross, everybody. But Dr. Ross, so how are you doing this evening?
I'm doing great, Bishop. I'm doing great, Bishop. I really appreciate the opportunity to come back to your church and to share information. I just spent the past month working in Barnes Jewish Hospital, taking care of patients with COVID and coronavirus in the intensive care unit. So it's amazing what I've seen, and I'm now even more geared up to talk about prevention so that we don't have to see that type of outcomes that I've seen in the past month.
Yes, sir. Yes, sir. Now, everybody, I want you to know that Dr. Ross and I, we have our masks either down or off because we are more than 6 to 8 feet apart, socially distanced. If we're closer to that, we should have our mask on. But right now, we're fine, and therefore, if we follow that rule, it helps all of our lives. Dr. Ross, my first question I want to ask you today is just, could you give us an assessment where this pandemic is now in this nation?
Sure, Bishop. Well, right now we are. I would hope to say that we're cresting as a nation. That is, I would hope to have said that we were flat, but it's kind of there are different effects of the virus in different parts of the country. Overall, as the United States, we're nearing 200,000 deaths since this pandemic started, with almost 6.7 million cases. And as you can only imagine, there's a disproportionate toll on African Americans, Latinos, other indigenous people of color. As African Americans, we constitute 12% of the population, but still about 25% of the deaths. Back in April, and when we were peaking, we were seeing about 80,000 cases a day in the United States. We peaked, and then we started to downturn, and that was good. And when we downturned, we hit a level of 20,000 cases. And we opened up the economy. And then we started to rise again, going up to almost 40, 50,000, at one point 70,000 cases, almost mirroring what we had back in April, because we opened up too quickly, we weren't properly distanced, and we were not wearing masks appropriately. And that's why we started seeing the increase. So right now, Bishop, what we do as epidemiologists is look at the percentage of cases that are positive for the coronavirus. We want less than 5% positive. In Missouri, we're about 10%. The hardest hit areas of the country, a few months ago, were at 30%. And so we're still, we're twice above where we should be. So as a state, we're doing not as well. As a country, we still have not fallen below that threshold we had a few months ago. So we're not there. And the problem is that we have a a change in the demographic distribution of the cases. Back when I was here before, most of the patients who were getting ill were elderly patients, patients with comorbid illnesses like diabetes and heart disease, kidney disease. Right now, there's this demographic shift. And in this country, we're seeing that the new cases are primarily in patients who are 18 to 25 to 30 years of age. So they're the ones who are having the more rapid increase in cases. That's the difference between where we are now and where we were 4 or 5 months ago.
Thank you. Now, the one thing we all are hearing about and looking for is a vaccine. Supposedly there are, 6 companies in the world that are working to try to develop a vaccine so people may be able to conquer this virus. Now, most of the companies are in, I understand, phase 3 trials. Could you please explain to us what these trials are?
Sure. So it's really important that we all understand this because we want to make sure that whatever vaccine emerges has been thoroughly vetted and really proven to be safe and effective. And that's why the National Institutes of Health has these guidelines for getting us through 3 phases of trials. I mean, obviously, we start with testing of animals to make sure that that a vaccine works. Mm-hmm. Once we know that the vaccine works, then we take it out of an animal and we get a small group of volunteers, of patients, and we administer the vaccine to them, and then we actually see if the virus is indeed, if the vaccine is indeed safe in that population, a small population, just testing to make sure it's safe and effective. If that's the case, that's the phase 1. Then we move to phase 2. In phase 2, we want to say, okay, if the vaccine works and if it's safe, what dose do we use? And what type of formulation? How do we give it, with different molecules? How do we make it so that it's delivered well? That's phase 2. And if the vaccine gets to phase 2, then the Cadillac of trials is the phase 3. That's a large trial, multi-center, multi-state, tens of thousands of patients across the spectrum, black and white, Latino, Asian, as many as possible, to really document that, yes, this trial is indeed safe and it's effective. And we're now in phase 3 trials. We're not near the end, despite what you hear, but we're solidly within phase 3. That's good news for us.
Okay. Now, with the trials, the trials definitely require, in phase 3, we need people for those trials. Now, one of the issues that I've heard is that for a lot of pharmaceuticals, for their trials, when they get to that phase 3, they want people of all nationality, all races, but African Americans tend not to participate. Could you explain to us why it's good that we should participate?
Well, here's the reason why it's good that we as African Americans participate in these trials, because we are the ones who are disproportionately shouldering the burden of the coronavirus epidemic. We're more likely to contract the virus, we're more likely to get ill, we're more likely to die. The data, the evidence is consistent across the country that we're dying disproportionately of the virus. We're a vulnerable population for lots of reasons that I hope we may talk about a little later. So if we're the most vulnerable population, along with Latinos and Latinx population and particularly Native American population, if we're the most vulnerable, then we should be the ones who receive the vaccine early because we want to stave off complications. We want to stave off infections. And so you would want to protect your most vulnerable group. I mean, that's what we do as a society, or rather what we should do as a society, protect the most vulnerable. And that's why, as African Americans, we should be at the front of the line when we have a properly vetted, registered, approved by the FDA vaccine. that's documented safe and effective. We have to be there as African Americans because we're the ones who are suffering from the disease compared to other ethnic groups in the country.
Now, one question I want to ask is that is seemingly why we as African Americans do not participate. There were some horror stories from the past, the Tuskegee Project and so forth. What advice would you give? This is just your personal advice to, as you've already stated, to help people to look beyond and feel comfortable to participate. Are there better regulations now so that people can participate and not fear they're being just a guinea pig without knowledge?
Right, Bishop, that's so important. As African Americans, we have, I think, a reasonable and a relatively logical reason to be suspicious of interventions in our community that are thrust upon us without us being aware of the process and without us being involved in the discussions about the safety and effectiveness. We've been there. You just alluded to the Tuskegee trial. Mm-hmm. So it's really important that African Americans, policymakers, and scientists and physicians are there during the discussion of the vaccine preparation, so they can actually see the process. They can say, "We were there. We saw this. This was done correctly." That will help validate the vaccine when it's available. But the suspicion is justifiable based on what's happened to people of color in this country over the decades and centuries. We have every reason to be suspicious. But that doesn't mean that we can't be converted into acceptors. We just have to have the confidence that what is being delivered to us in the vaccine has been rigorously tested, proven to be effective, not being thrust on us by someone who has ulterior motives with some set deadline before an election. We don't want to hear that. Right. We want to make sure that this vaccine is being delivered to us by scientists that we can trust, in a process that we understand, in a way that allows us to access it without any impact on our financial situation, and in a way that we can receive without having an undue burden on us as we are trying to access physicians or healthcare professionals or get transportation. We want to make sure that there is awareness of the conditions that we as black people live in this country. And when someone comes to offers us a vaccine and say, well, you people aren't coming, you don't trust us. No, we have to stand up as black people and say, look, we've been demanding for years, for decades, proper housing, proper nutrition, access to care, proper jobs, criminal justice reform. We've been asking for this for years. This is killing us. All these problems that are weighing on us. And so we have to look at, my goodness, we have death by violence or death by coronavirus. And we don't want to have this presented to us as, well, you have to choose.
Right.
We don't want that. We want to say that, we want to hear that African Americans, black Americans, we understand what's happening in this country. We understand the long-standing effects of structural racism. We realize what happened. We want to make amends. We want to do what's right, what's just for this country. And we're going to create this process where there really is restorative justice. And part of that restorative justice is showing you with great sincerity that this vaccine has been produced with all the scrutiny, all the scientific scrutiny, that it's safe. And we're preparing this specifically because we care for the African American community. When it's presented that way, then people will hear, and when people will say, we appreciate that. It can't be thrust upon us. And I'm hoping that that's the process that we'll hear when the vaccine is ultimately available.
Thank you. Thank you very much. Now, if someone wants to participate in a test trial, how do they go about becoming involved?
Well, so Washington University and St. Louis University Schools of Medicine, both part of this nationwide registry. It's called the COVID-19 Prevention Network. And you can certainly go online and Google COVID-19 Prevention Network and call in to that network, and you can be directed to clinicians and people at Washington University School of Medicine or St. Louis University and register for a clinical trial that way. It's going to be fairly easy. We need more participation. Right now, I was just listening to a report from the NIH on African American participation. Right now, in one large trial, we're doing relatively well with about 18 to 20% African American participation in this trial. We want more than that. We want to actually exceed that the number, the percentage in the population. We want to have a higher percentage of patients in that trial, of people in that trial, maybe 40%. And so it's really important that we call in to the COVID-19 Prevention Network at WashU and SLU and say, I heard that you're doing this trial. I want to be a part of this. There are great opportunities to do those trials as well as do other trials regarding the COVID, not just the vaccine, but other trials we're looking at testing. And so I urge all of us to follow up and sign on to those trials.
Very good. Now, when a person's involved in a test trial, like phase 3, could you explain, do they actually receive the disease, or what will actually take place? Because I understand there's something's given, and then there's a placebo that's given too. Could you explain it to us, please?
Sure. So here's what happens. So we take this coronavirus, and we look at some proteins that are on the surface of it, the proteins that allow that virus to attach to our cells. We can take out those proteins, and we can see how it's designed. And then we can go into the laboratory and we can engineer a product that mirrors that virus. It's not active. It has, it's through genetic engineering we can create a product that looks like that virus, and then we can generate antibodies against that genetically engineered product. So we're not really that's what we use then in the vaccine. And so there's no live vaccine going into your body, unlike what many people remember about smallpox. Years ago, I got my smallpox vaccine. Bishop, I'm sure you had yours also.
Yeah, sure
that was
did.
a live vaccine.
Oh, really?
Right. Or it was attenuated, rather. That's the right word. It was attenuated. And so, this vaccine is not a live vaccine. It's not a disease. It's an engineered product based on a marker of the virus, and we know, and we have evidence that we can use this marker, put it in an animal, and show that the animal can produce antibodies against that, and those antibodies protect that animal. That's how we know that the vaccine works. It's not delivering a disease. So we want to make sure that's clear.
Thank you. Now, in England, I believe there was a pharmaceutical company recently. They had to stop their phase 3 trial. I believe now they have permission to pick it back up because some people are getting ill. Do you have any knowledge of what was taking place there?
We don't know a whole lot of what happened, but it was a large company, AstraZeneca, one of the worldwide company that was producing this vaccine in collaboration with not Cambridge, but I'm blocking on the school, Oxford, I'm sorry, and with Oxford University. And so these are prestigious university and a prestigious company. And they're in phase 3 vaccine, and one of the volunteers developed an illness. Now, it hasn't been clear what the degree of the illness was. I do know that the patient did well afterwards, but when the vaccine overseers, when the scientists heard of the illness, they said, well, let's put things on hold and let's go back and review. You know what? That's precisely what you should do in a clinical trial. That's the whole purpose of the clinical trial, to document safety and effectiveness. And when there's an issue with safety, you stop the trial, you go back and you troubleshoot, and then you figure out what the issue was, and then you resume the trial. And so they're to be commended for what they did.
Very good, very good.
They were protecting us by stopping the trial and making sure they can figure out what exactly happened to that patient.
Excellent, excellent. Now, there's a lot of different chatter of when the vaccine may become public to the world. Do you have any information when that might take place, when it's safe to use?
Yes. So and this is actually going to be encouraging. Anything could go wrong because we're phase 3 trials, but most of the information I'm hearing consistently with at least 2 or 3 large corporations, particularly Pfizer, which we have here in St. Louis, and another organization called Moderna, along with that third one I mentioned, AstraZeneca. There are another 15 or so companies out there, but these are the big 3 that have made the greatest progress. And based on what I'm hearing them say, based on the data that they're sharing, it's quite likely that we will see a vaccine emerge by the end of this year. Now that doesn't mean that vaccine is going to be widely available, because when they finally get a vaccine that is safe, that is effective, it's been signed off by the FDA, and this has been proven to be effective, then the first thing that they're going to want to do is vaccinate the population that is greatest risk. That includes, frankly, people like me, healthcare providers who are going to be there at the front lines.
Right.
And then the individuals that I mentioned before who are going to be at the highest risk. The elderly, individuals who have diabetes, who have heart disease, have kidney disease. I mean, there's going to be a long list of people who will get this vaccine early on. Early on probably means, January of 2021, to be frank. And so, again, based on the projections that I'm hearing, including that from Dr. Fauci, Anthony Fauci, who is perhaps the most credible expert in the world on this, that we probably will have a vaccine available for wide distribution in early spring, if we're fortunate. I would say March or April at latest, we should be seeing widespread distribution of a vaccine. To say that we're going to have a vaccine by the end of October or before November 3rd, Election Day, I think is a bit disingenuous to say that. I don't think that's going to happen, and frankly, I would have concerns about anyone who would fast track a vaccine bypassing the regulations of the FDA. That's what we don't want.
Thank you, thank you. Now, with the flu season coming, and some people are very concerned with the COVID-19 affecting people's respiratory systems, and the flu season that impact people's respiratory systems. Some people I'm hearing become very leery, and they're almost scared to go to the doctor. But could you explain to us why we still need a flu shot? And if a person has some type of symptoms and it's really more like the flu, how they kind of distinguish the difference between the two?
That's an excellent point to make. So can you distinguish the differences between the flu and the coronavirus, the COVID-19? They both will present with fever. They can present with chills and cough. It's going to be hard to discern who has the flu or COVID. Now, we do know that COVID-19 has a different set of symptoms. Sometimes patients may have loss of taste and smell, and sometimes they can have stomach ache and diarrhea, but frankly, sometimes that can happen in the flu also. So if you can't really distinguish the two that well, then the easiest thing to do, the safest thing to do, is to protect. At least we have a vaccination which could protect a large portion of the population against the flu. And at least we can eliminate that as hopefully as a threat by taking the flu vaccine, and so that takes that off that's off, that equation is off the table. Now we can say, well now they've had the flu vaccine. If they present with these symptoms, it may more likely be the coronavirus, the COVID-19. That's why it's so important to get the flu shot early. And that's why the flu shot is being made available earlier than last year. And so I'm hoping that in fact, I'm very confident that our community is going to avail themselves of that flu shot as quickly as possible. The issue now is that if one has the flu, one gets ill. Guess what happens if you're ill? If you have respiratory symptoms from the flu, that makes you more susceptible to the coronavirus. And so that's a double whammy. So you don't want to get sick from something that you can get vaccinated against. That's why you must get a flu shot. We must get a flu shot. To not get a flu shot is put ourselves at risk for the coronavirus. And can you imagine having both of those at the same time?
Wow.
That's what we don't want.
Wow. With that, you get the flu shot, then also those adults that may suffer from respiratory problems chronically, should they also get a pneumonia shot?
Well, so over a certain age, yes, individuals should get a pneumonia shot, and that's something that your doctor can do regularly. There's no need to rush and get a pneumonia shot. I think that should be according to the timetable that your own doctor sets out. The most important thing right now is to get that flu shot.
Okay, good, very good, very good, very good. Another question that I have is that with so many patients that become chronically ill with COVID-19, or we could say definitely ill with COVID-19, and it seemed to have been that for the older people, it was the underlying conditions, but also that could be in younger people too. Why do these underlying conditions seem to be magnified with COVID-19?
No, we don't have the full answer to that. And I can, for those who really want to go deep into the science, I could pull up a blackboard and I could start drawing molecules and receptors for you, and bore you to tears. So I won't do that. What we do know is that individuals with chronic diseases, and we know which diseases put you at greater risk for COVID-19 based on long-standing reports, even coming out of Wuhan when we were looking at the data back in December. Individuals who have diabetes, who have high blood pressure, who are overweight, who have chronic lung disease, you mentioned that, Bishop, who have kidney disease. Kidney disease is a major risk factor for coronavirus. These individuals, along, of course, with the elderly, we mentioned that before, are at the highest risk. And is there some unifying reason why these individuals are at the highest risk? We don't have all the answers at this time. What we can say is that because of their chronic diseases, they have a greater amount of inflammation in the body. And that for some reason may change how the virus is picked up, because there are certain receptors that are on the cells when you have this chronic inflammation. And so when you have a chronic disease, you have this chronic inflammation, and that makes you susceptible. It's much more complicated than that. We don't have all the science figured out, but we do know that those individuals are at risk and will remain at risk. Some of those individuals are the same ones that are at risk for the flu now, Bishop.
Right.
For the same reasons. But we're seeing a magnified risk with coronavirus, because we now know that coronavirus is 10 to 20 times more likely to infect and more likely to kill than the flu. So when you have those risk factors, you definitely should go as much as possible to protect yourself. Until we can figure out more of that mechanism, and we will eventually.
Okay, thank you. Now, another question I have is that dealing with underlying conditions, if a person has an underlying condition, for instance, high blood pressure, but they're keeping it controlled, they're very consistent with their medication, they've had a nice history of it being under control, same things with diabetes, if they're keeping it under control, do they stand a better chance than someone who has underlying conditions that's not being managed?
The answer is absolutely yes.
Okay.
If you have a chronic condition, if you have diabetes and you're checking your sugars and they're never higher than 120, 140, if you have high blood pressure and you check your blood pressure every day and it's 130/70, I mean, if you have kidney disease, but you've been following your doctor's guidelines and taking your medications, your creatinine has been stable for the past year, if all those things are occurring, then you're less likely to have this state of inflammation, and you're at lower risk. Now that doesn't mean that you're at relatively lower risk, but I want everyone to be mindful that this virus is attacking people who have no risk factors.
Right.
Also.
Right.
So it's just a matter of how it's relative to one person versus another. And so if you have full-blown disease, you're going to be at the highest risk. If you have chronic diseases, you're going to be at that risk, moderate risk. If you have no disease, you're still going to be at risk, but you won't be at the risk level of someone who has severe, uncontrolled chronic diseases. Hope that makes sense. So absolutely, control your chronic diseases. Really understand the importance of chronic disease self-management in collaboration with your providers. That will absolutely reduce the likelihood that you will contract the coronavirus.
Thank you. So therefore, when people are feeling real good and feel, I don't need that medication anymore, they should stay on the regimen until their doctor say, stop taking that, so that they can maintain good health and to reduce inflammation in the body.
Yes, we know that for a fact, that this is no time to get cavalier about this, as we already have, as we started at the beginning of this show, we already have high levels of virus still out there, okay? It's still propagating, it's still moving in the community. It's nowhere near where it should be. We still have high levels of virus. We're now throwing in the influenza on top of this horrible pandemic. In the next month or so, we're going to be in the midst of the flu season. And so this is the time to be your healthiest. I mean, this is the time to get those fluids going, to back off on the things that you know are unhealthy, and to really engage in the exercise, because we're now about to be assaulted the way we've never been assaulted in terms of this virus attacking us as a people. We got to put on our armor, folks. We have to protect ourselves, and that means ensuring that we have the best overall condition going into this fall as we've ever had.
Well, thank you. Now, the one question I have for you too is that one thing I've been hearing been taking place. There have been a lot of cancellations there's been a lot of cancellation of doctor appointments, and the lack and the cancellation of pre-screening. And it seems that some people are concerned, is it safe to go to the doctor's office or not, or to go to the hospital for a screening process? But if they don't go, there could also be risk of something that could have been early detected, now developing something that causes much more problems. What would be your advice, doctor?
So I get this even now. I have patients calling my office, saying, Dr. Ross, I don't want to come down there to the Barnes-Jewish Hospital. I don't want to be exposed to people who may have that virus. I'm going to stay home. Now, we fortunately have an ability right now through telehealth for individuals who for legitimate reasons can't make it out of the hospital. We can now call them or use platforms such as Zoom and Doximity and others. So we and just using a regular phone is, if you can't make it out the house, you should still contact your physician and have a visit that way. But it's always best to come in and see your doctor. I mean, I can tell you something. There are a lot of diagnoses I can make when I'm right there in front of you than when you're behind a phone or computer screen. I can't make a lot of diagnoses. There's some information that I can't elicit when it's distance like that. And so it's important that I see patients, that I do a physical examination on them, that I really have a chance to really talk to them about information in more detail. And so when you come to our hospital or come to your doctor's clinic, all us as providers, we're going to make sure that we're adhering to the highest level of hygiene. Everything is scrubbed down before you come in and after you leave, after your visit. Everyone's wearing the mask. Everyone is wearing that mask. And everyone is, our waiting rooms are structured so that no one is sitting right next to each other. We're adhering to this social distancing. And so when you go to the doctor, you should be reassured that they've taken the necessary precautions to keep you as safe as possible.
Very, very good. Now, the one thing that's taking place during this, we're also heading toward the holiday season. And everybody during the holiday season wants to be very social. Family comes together. We sit down, have our turkey, our ham, but the concern is, what advice would the medical community give? How should families come together? What should be the precaution? Because it seems to be that in the social gatherings where people are contracting, they let the guards down. Would there be some advice you give them when people go to social gatherings?
So we're as a people, our culture really moves us to love each other and to hug each other and to be social. That's good. That's how we sustain each other over the years, over the decades, over the centuries in this country. That's part of us as black people. We have to look at how long we've been here and how long we want to stay. And we don't want anything to take us out too early. We don't want a premature death from something that is preventable.
Right.
And so Bishop, if this is going to be one Thanksgiving or one Christmas where we just simply have to keep a small group, family, small nuclear family, maybe 4 or 5 at the table, and then we're going to have to just call, cousins and some aunties a little later after that meal. This is what we need to do this year, folks. We're going to have to, this is going to be tough. It's going to be hard. But this is in our best interest to really reduce the size of our gatherings during the holiday. We should not be having a house full of people, 10 or more people, for a gathering this year. That's hard for me to say because I love, we love large gatherings in our home. It's hard for me to say, but honestly, we're in the thick of this still. We're at risk. We have many more Thanksgivings and Christmases in the future. Let's do the right thing and get us through this one year. And then we'll be situated to really celebrate when we have this vaccine early next year and we can get through this. But let's buckle down, let's keep the family size small, and let's just simply get through this year. Love can permeate phones and computers and walls. And so just let people know that you love them, but this is not a time to be having large gatherings.
Thank you. Now, Doc, I'm going to ask you this question, and you might not be able to answer this question, but this is from rumors and from things being passed along the airways in different groups. There are people that are already saying the problem would not be the coronavirus, it's going to be the vaccine. And that the vaccine is going to be laced with something that from in the Bible will give you the mark of the beast. Could you just kind of talk about that for a moment, if possible, that if that's true or not?
So I've heard conspiracy theories out there that just will knock your socks off. And we have to ask ourselves, where are we getting this information, first of all?
Right.
Okay, so when I want scientific information, I go to the place where I can find the science. And I don't go to Facebook to get scientific information.
Right.
I don't go to Instagram to get scientific information. That's not where you're going to find that. And I know about all these new social media platforms, and I've seen the misinformation that circulates on those platforms. It circulates widely. My own family members will call me saying, is this possible? Someone even called and said, is it possible that this virus was indeed transmitted through a 5G network? And so many of you have heard that.
Yeah.
That's out there. And so we have to be able to comb through all that garbage, because that's what it is. It's internet garbage. And really listen to people who are in the know, people who know science, people who know medicine. We need to call them. We need to verify what we hear. We just can't take it at face value. And so this vaccine is going through rigorous testing. It gets tested in animals first. It gets phase 1 to make sure that it's safe in humans. Phase 2 to make sure we know the right dose and the right way of delivering it. Phase 3 to make sure we can do it in large populations, to make sure and ensure that everyone, African Americans, Latinos, Asians, whites, everyone's involved, because one population may have a different immune response compared to the other. You want to have large-scale populations involved in this phase 3 clinical trial. You want to get that trial out, have it approved, and then you have a safe vaccine. That's how science works. We have to make sure the process follows that guideline. It takes months to generate a proper vaccine and to get it through those trials. Months. My goodness, we still don't have an HIV vaccine, and that started in the late 80s. So it's hard to do a vaccine, and it's hard to do it safely. And so let's listen to the experts. Let's hear what they're saying. And let's not listen to these things we hear. Frankly, when you hear something, it sounds suspicious, it usually is suspicious. Okay? If it don't sound right, it probably ain't right.
Right.
So just validate the things that you hear.
Well, I want to thank you, Dr. Ross, because you really are helping to enlighten us. So therefore, the vaccine, you explained to us about the 3 stages of the different trials, and that the main thing is that the vaccine, when it does become mass produced, will be safe.
Yes.
But what everybody needs to pay attention to is take care of your health now.
Yes.
If you need to see your doctor, see your doctor. If you have screenings, you take your screenings. If you have medications to keep your body regularly on an even temperament, you should do so. The reason why we're doing this show tonight is because with the vaccine coming, we want to make sure we will preserve ourselves with wisdom, knowledge, and understanding. And Dr. Ross is an expert in this field, and he is taking his time also graciously to come to be with us tonight to share this information. Dr. Ross, I want to thank you, my friend, immensely for your time tonight and for the information that you have shared. And I do want to tell everybody this, to show you know some things going on at Greater Grace Church. If you know some people that need fresh fruits and vegetables, on Friday at 2 o'clock on our west parking lot, we'll be distributing fresh fruits and vegetables from 2 to 6 p.m. or until we run out. And it's about 28 pounds per box. And we're doing this in partnership with Christian Hospital Northeast and also Operation Food Surge. So I thank them very much that we can participate together to be a help to the community. And if you do want to get out of the house, Friday night, we're going to have a drive-in movie here on the west parking lot. Come in your cars. It's a big 38-foot tall screen, and it's $20 a car. So you can have, if you got people in your car from your household, you could come and have a good time. There'll be some food available out here as well too. But remember, we will still be practicing social distance if you get out of your car, and bring your mask, because we want to make sure whatever we do, we stay healthy. Yes. And of course, I look forward to seeing everybody on Sunday, either live in person or live streaming or Facebook Live. And again, Dr. Ross, thank you immensely that you give us information to stay well and have good health.
Bishop, thank you for inviting me.
I thank you for coming, my friend. Thank you so much. And to everybody, you have a great night. God bless you. Love you to life.